In the public health world, for many years, people have known that if a virus started someplace, any place, it would travel enormously quickly.
I first heard about COVID back in December of 2019. Many of our patients have family members and community within Asia, so I think there was a heightened awareness of how severe COVID is.
I really thought it was gonna blow over. I really did. I thought it was gonna kind of come and go, and by now we'd be back to normal.
My initial reaction was, okay, yep, a new virus, yep, it can be deadly, but we have the capability, we have the infrastructure to mitigate everything that we didn't do, as it turns out.
I don't think most of us thought how bad it could get. You heard the projections, but you're kind of like, oh, it's not going to get that bad. I never would have imagined it.
We have experienced and will continue to experience the grief of many people dying. The risk and danger of illness is substantially higher in our communities.
The pandemic has highlighted the inequality that we have in our country today.
We know in this country that if you are poor and you are a person of color, your health outcomes are worse than if you're someone who looks like me. This is not because there is something biologically different about white people and black people and Latinx people.
It's because of those inequalities that have, for decades now, just continued to progress, and no one's really doing anything about it.
COVID affects everyone, period. How we respond to it in different communities, how we allocate resources to different communities determines who's going to thrive, merely survive, or be despised in America. There has been a lot of anti-Asian rhetoric. The Asian community has sustained a lot of blame. We've had patients who have been ostracized riding the bus because they were Chinese. We've had patients who had rocks thrown at them while they were riding the bicycle by other children, saying that they were the cause of the coronavirus.
We are all in this country dealing with some level of fear about this virus. It's crucial that we root this in science, that we separate that from anything that is political or partisan in any way.
That is the beauty of community health centers and standing to fight this together. We provide things like robust testing services for the community and walk-in drive-through testing sites.
We've reduced the number of patients so that we don't overload the waiting room. We've added more cleaning throughout the day.
We've responded by converting to telemedicine. We've responded by producing COVID hotlines in different languages. There is a whole team, and we all work together.
We should be at a point where we've got enough vaccination coverage that we can start getting to some semblance of what our pre-COVID days were.
Now it's going to be a new normal. So now, masks will be very common.
The one shining moment is the speed with which vaccines were created and developed.
We also have to recognize that in communities of color in this country, there is a level of appropriate distrust of government-led medicine and vaccine campaigns born from atrocious experiences with organized medicine in the very recent past.
You have a choice, but your best choice is to take the vaccine. We don't know what the long-term effects will be, but we do know what the long-term effects of COVID are.
This virus is widespread. We know that it is actively mutating. We must stay vigilant. Moments of challenge like this call us to bring out the best parts of ourselves, and that's what we're all doing now.
That has been the part that is most heartening, to see the medical community just really rise up and respond, to see the scientists rise up and respond, and then even the government rise up and respond.
That really is what America is all about. Rising up, becoming stronger, making the community greater and better. And that's what we hope to do by standing with our brothers and sisters across the country in this work against COVID.